An important diagnostic tool that is commonly being employed by the gastroenterologist of late is the EGD, meaning Esophagogastroduodenoscopy. It is an important diagnostic technique. With this diagnostic technique, there are so many procedures that are being done. Okay, so some of which that we commonly find is the biopsy, esophageal EGD with biopsy. We also have like ultrasound guidance, and there is also an aspiration biopsy. Okay, if they are going to take a fluid mass, they're going to insert a fine needle aspiration biopsy. A sclerosant. What is a sclerosant? So there is a condition called like esophageal varices where bleeding occurs. So at that time, the physician is going to inject a drug that causes sclerosing or hardening of the bleeding vessels, which are the esophageal veins. So a physician injects a medicine. A patient is presenting with dysphagia, or he or she is having like strictures. That case, a physician dilates via EGD, he dilates the strictures, so we have a separate code. A patient who is having feeding problems can have a PEG placement, percutaneous endoscopic gastrostomy tube placement. So we have an EGD with a PEG placement code. There is a foreign body, you can remove that via EGD. Next is optical endomicroscopy. What happens here is the abnormal tissue can be viewed. There are like visual changes that are being seen in an EGD, and a sample of that tissue can be taken. So polyps can be removed, tumors can be removed. Coming to dilation, there are two types. One is a bogie dilation, the other is a dilation via balloon dilation. So you need to know the pressure measurements, and accordingly you can report the codes.